Very pleased to be here to talk to you today about one of my quiet passions. I teach the history of medicine, the history and philosophy of Western medicine at the university, and the 20th century has always been one of my favorites. Interestingly enough, I waffle between the 12th century and the 20th century. But today we're going to talk about the 20th century, and I'm going to introduce you to some individuals. You see 7 of them here on the screen, who I know have personally touched all of your lives. If not directly, certainly indirectly. And these individuals have contributed to your health, to your welfare, and they're illustrative of this miraculous century that has seen your life expectancy go from 47 years of age, which it was in 1900, to 79 years of age, or nearly doubling of life expectancy by the year 2000. We're currently now at about 84 years of age for women and about 80 years for men, due in no small measure to these individuals. I call your attention first, of course, to Karl Landsteiner and Alexis Carrel. The next individual is Henry Fleming, then Ernst Chain, Charles Best, Frederick Banting, and Rosalind Franklin. Now, I will ask you to bear in mind, as we examine this, that none of these people worked alone. They all stood on the shoulders of other giants. There were no discoveries or descriptions in medicine that did not follow the hard work of many, many people before that, and I hope to point that out to you. I also am going to tell you about some of the gossip, how some of the personalities got in the way. And I'm going to tell you about the things that the Nobel Committee got right. Some things they got right, some they got wrong. Normally, in a smaller venue, I simply tell you to raise your hand if you have an immediate question, and I'll answer it on the spot. Because if you don't understand anything, the sequence that follows may be a little bit difficult to comprehend. But this is kind of a large venue. And so perhaps what I think I'll do is I will wait until the very end and handle your questions then. So make a mental note of it as they occur. Now, 2 of the discoveries that we will touch on really didn't happen in the 20th century. They started earlier. They were discovered towards the end of the 19th century. They were both very important, but they did not see their importance come to life until the 20th century. And I'm referring to, first of all, the discovery by William Conrad Röntgen of the X-ray. At first, it caught the fancy of the public as something fun. And you all remember the iconic photograph of the hand with the ring, which was the first X-ray that Röntgen took, and it happened to be his wife's hand. So people didn't see an immediate application to it, and it didn't occur until the 20th century. Similarly, the work that Marie Curie did, Pierre and Marie Curie did with radium and radiology, did not come to fruition until the 20th century. And then when it did, it was unfortunately taken up by the public in a nostrum type of way, so that people were fascinated by the fact that this radium glowed, that it was producing a new type of energy that had been unknown prior to this. They started putting radium in things like water, face creams, liniments. People wanted this energy. And unbeknownst to them, of course, they were poisoning themselves. In fact, some of these individuals that had been using these nostrums, when you held an ionizing radiator detector to their breath, they were actually exhaling radon. Obviously, a very detrimental way to be using makeup. And of course, we're here old enough to remember the luminous dial on our wristwatches we were very proud of. We could see at night, and on our clocks. And of course, these were painted by the famous radium painters, dial painters, who would dip their brush into radium paint and very finely sketch out the numbers on the clock and the arms of the clock. And when the numbers in the painting got smudged, they realized they had to sharpen their paintbrush. So they would put it in their mouth and get a nice little point on the brush and go back to painting. poisoning themselves gradually with radium, and almost all of the radium dial painters died of aplastic anemia. That is to say, they were unable to make, their bone marrow was poisoned, and they were unable to make red cells. And sadly, that's what killed Marie Curie too, after many years of exposure to radium. But let's begin right now with the actual 20th century, and I'm going to take you to 1900, and the very first discovery, or description, I should say, of the red cell blood groups by Karl Landsteiner, the very first man that I showed you out on that illustration. It's an old story. Landsteiner, as a physician, knew it. It had been known since the beginning of time that if you bled and you lost enough blood, you would die of shock. You would go into a low blood pressure system where there would be no perfusion of your brain, your heart, your kidneys. In short, you would die a death of sanguination and lack of oxygen. And as early as the 1600s, people started to work with this. You can see here, for example, in this illustration on the far side, the great French surgeon, Jean Denis, transfusing an individual using a lamb. Because the first experiments were animal to human transfusion. He wasn't the only one. In England, Richard Lauer did animal to human transfusions. In America, Philip Singh Physic did animal to human transfusions. They didn't work. They didn't know why. We now know why, thanks to Karl Landsteiner. And the fellow in the middle, James Blundell, was an obstetrician at St. Thomas Hospital and St. Guy's Hospital in London. Now, Blundell had read all of the studies and experimentations conducted by these individuals. And he left in his diary some very touching notes as he described the agita and lamentation that he felt when a young mother would come in vibrant with a new baby. She would deliver a piping, beautiful baby, only to go and exsanguinate to death 5 or 6 hours later, either because of a retained placenta or afterbirth, or because there was a tear in the uterus, or simply because the uterus didn't contract. For whatever reason, she would keep bleeding. And Blundell was helpless. And he knew that all he had to do was buy a little bit of time, a little transfusion, buy her 24 hours to have that raw uterus heal and contract, and he would have salvaged a mother to nourish and suckle her new baby. So he decided to try the experimentation of transfusion. And based on his readings, he said, I'm not going to use animal blood, I'm going to use human blood. So he got volunteers, and he transfused some of his mothers, and as we expect, 50% did well. The other 50% died with excruciating back pain, tremendous headache, chest pain, passing Coca-Cola, dark urine, all the classical signs of a transfusion reaction. Because when you transfuse mixed blood that doesn't match, the red cells break up, and so you urinate dark urine, and you get clots and hemorrhages going to your kidneys, your brain, and your heart. It's a terrible, painful death. 50% made it, 15% didn't. We know why. So did Karl Landsteiner. He came along, and in 1900 started his experimentation. Now, what did he do? He mixed samples of blood, because he knew the problem was somewhere in the red cells or the plasma. And lo and behold, as you see in this illustration, when he mixed the right blood, as you see in disc number 1 and disc number 5, it remained liquid. But when he mixed the wrong bloods, as you see in the little illustration in the corner, the blood agglutinated, it clotted. It formed little minuscule clots. This agglutination you can see very clearly in disc 2 and disc 5. So now Landsteiner figured it out. The problem wasn't with the process. The problem was with something in the red cells that was causing them to clump together. And as they clumped together, if you kept giving the wrong blood, these clots would get bigger and bigger and bigger until finally they shut off circulation to the brain, the heart, the kidneys. In short, you died of transfusion reaction. So what did he do? He identified these groups, and at first he called them type A, type B, and type X blood. Later on, of course, it was renamed to the famous type O blood. But when he first described it, it was ABX. Now what? We were able to give safe transfusions. A brand new revolution. There was one problem, though.